Currently, I'm doing a lot of translational research. While working at MGH, I started looking at skin cancers, looking at the margins of skin cancers, and it turned out that very often even experienced dermatologists miss the correct margin, the exact margin, and so when they try to excise a lesion or treat the lesion, even like oncologists, when they treat it with radiation, they miss the margins, and that means that repetitive treatments are required. And since then, I've been working on trying to help them visualize these margins before they start cutting or before they start treating the patient. And this work is currently in clinical trials. We've completed one trial at MGH, and now we're in the process of collecting data at the University of Massachusetts Hospital in Worcester. Most of my work is very practical, so I really enjoy it that I can see the results right away. I don't have to wait for like 10, 20, maybe 50 years to see what will happen. We also are doing some work looking at cancer at the cellular level, and this is the work I will be presenting at FiO. We are looking at breast cancer cells. We are taking the cells from the patients, and we are performing both imaging, fluorescence emission imaging, and fluorescence polarization imaging and analysis. And we look at the cells both morphologically, and we find out what the fluorescence polarization is, and we are able very well to separate cancerous cells from normal cells. And we believe this technology has a huge promise, because right now, whatever diagnosis is made, it is based on qualitative information, and it's subjective. The diagnosis is delivered by pathologists who looks at the tissues and cells under the microscope and decides, based on the size of the nuclei, mitosis, and other architectural characteristics of the tissues and cells, whether it's normal or cancer. That is why cytology may yield up to 40% of false negatives, which is very dangerous. And we hope that we'll be able to sort it out. We are still in the beginning here with this project, but we already are getting very good data from the patients.